welcome to A Closer Look. I'm Crystal Carter. One of the leading topics today in trending is healthcare, especially in our region when there are several mandates and laws being passed that could influence not only rural hospitals, but the larger hospitals that we see. Joining us today is Hild. He is the Executive Director of Consumer Research. Welcome.
Great to be with you.
So I want to start by asking, you said that there were findings that you had at Vanderbilt Hospital, which for our area is the larger hospital that people are sent to when they can't be treated by our largest hospital here.
That's right. This started because we were doing an overall look at wokeism inside the medical industry. And one of the things we found at Vanderbilt Medical System is we looked into them, particularly for DEI, diversity, equity, and inclusion activities, meaning discrimination based on race and sex, is as we were looking at their activities, they started to hide all of their websites behind password protection. And what this suggests is that instead of ceasing DEI as instructed to do by the president's recent executive order, they're simply hiding it. And that's particularly alarming because during the Biden administration, Vanderbilt Medical Center was given a rather large grant from NIH to engage in DEI. And this is something that they're supposed to be ceasing, but obviously they probably do not want to both get rid of those activities, but also give back the money that was for that. So this is something that we believe is very important for elected officials to be looking into to make sure that they're following the law.
Okay, let's back up to the beginning. The first thing that I heard you talk about was DEI, diversity, equity, and inclusion. And you said it's based on race and sex, but that's not what DEI is. DEI is not just based on race and sex. It's based on physical abilities. It's based on mental ability. DEI is very far-reaching. So is it just that you did the study based on race and sex, or did you include all measures of DEI in this?
All measures of DEI. Race and sex tend to be the two things that are discriminated the most through DEI, but you're absolutely correct. They also discriminate based on a host of other issues, including sexual orientation.
And we have legal protections for those, of course, with the Americans with Disabilities Act and the Civil Rights Act that should cover both race and disability in this, just so that our audience members know. Now, you said that you found that they were using or perhaps using DEI and that it was also password protected. The one thing that I want to ask about this in particular is, why are we concentrating on this? Why are we not concentrating on people getting health care and not a political issue that doesn't have to do with direct care of patients?
Certainly. Well, DEI absolutely does reflect on direct care to patients. That's one of the reasons we brought it up as a consumer issue, because when you discriminate based on things other than merit, other than competence and skill in the medical industry, it directly relates to patient care. Some of the other hospitals that we found, like, for example, Cleveland Clinic, actually were engaging in DEI even in the way that they treat patients. They were creating specific programs that were related only to people of a certain race. In other words, they would triage people based on their race. DEI absolutely does affect consumer results, both in the corporate America writ large, in the marketplace writ large, but specifically in medicine, an area where we don't want any of that to be the reason why somebody does or does not get the absolute best care that they have. And this is something that is reflected now at the federal government in terms of policy, both at the presidential level, but also at the Health and Human Services. They are cracking down on DEI because of its deleterious effect on patient care.
So where is the proof in the pudding, so to speak, that this is happening, that there is an adverse care? And that is the first question. And the second question is, you mentioned that they were doing planned care based on certain races, but is it not a fact that there are certain races, certain sections of people that have diseases that are generally found in that particular population? So off the top of my head, I can tell you that African American men have the largest risk of heart disease disease, of diabetes, of having a stroke and not knowing it. They're also the lowest amount of people who get mental health. So why would it not be okay to have protocols for people when they have those specific things? Me, myself, as an Appalachian American, there are things that we face every day that are specific to us predominantly, such as lung cancer, because we have so many coal miners. And I appreciate that there's an office and that there's a place that is specifically working on that for the coal miners, again, regardless of their DEI status. But it's because we're Appalachian and we work in coal fields that this happens. So why is it not okay for something, sickle cell anemia, for example, that is predominant in one race over the others, for them not to have a plan for that particular group? Because that is their basic health care, correct?
Yes, certainly. That's a great question. I'm glad you asked it, because I was not saying that there shouldn't be care based on what we know to be risk factors related to certain races. What I was referring to when it came to the Cleveland Clinic is they set up something like, for example, minority men's health programs that were basically exclusive only to non-whites. That is not evidence-based medicine. That's not specific to a racial risk group. That's just discriminating based on race in terms of healthcare. And their own reasoning for why they were doing it had nothing to do with risk factors for specific diseases being higher in certain races. Had to do with trying to chase equity, or the idea that there had been overrepresentation of healthcare for some groups historically over others. So it was engaging in this DEI race-based equity activities. As far as the evidence for DEI decreasing the outcomes in healthcare, it's self-evident that when you discriminate for things not unrelated to skill and merit, you will get less of that. So if you're chasing bean counting around race and sex or any other of the factors you mentioned, that's what you will get. And we've seen that over and over again. We've seen that in corporate America. You have doors flying off Boeing airplanes because they're too focused on DEI instead of other things.
And I'm going to ask this very respected. So you have said this, but I'm asking you, and you've given me anecdotal evidence, plain that you can see. I'm asking you, where is the evidence? Where is the proof, documented proof, that DEI hinders healthcare? Does that exist?
Certainly, there's been a number of studies that have disproven the stuff that came out of McKinsey, for example, that showed that DEI was a overall increase in efficiency and competence in corporate America. I don't know of one that's been specific to healthcare, but there has been numerous studies that show that DEI is deleterious to the mission of organizations, and that's
so
true of any organization
study
that engages in it.
There is no study then
there are
for
numerous
healthcare.
Studies. Yes.
You just said there was no study for healthcare.
There's no specific study to healthcare, but there are studies that show that organizations that engage in DEI get declining results.
Now let's move on to the Cleveland Clinic, because I did a little bit of research into the Cleveland Clinic and what they said about the programs that you have marked DEI. And what they have said about those programs was not that they were trying to necessarily reach a certain person, as in a certain race, but that a large predominantly group, and most of those will be black men, and for some black women, are the ones that do not get health care. So they target to bring them in because they are unlikely to be able to afford health insurance, to get that health care, and to be getting health care before it's too late, before, that is, their diseases are so forward that treatment is even more than necessary, will cost them more than necessary, and that they are attracting them in so that they can get a start on their health care from the ground up, so that medical money is not wasted on treating them after it becomes a huge problem and it's gone from the outset. So for example, I'm going to use diabetes. They get the diabetes under control before they are wasting money doing amputations, or because the diabetes is so out of control, then they're at risk for heart disease. So that was the point that they made when they were filling out all of these grants that had to do with minorities and having minority programs. Now, you say for some reason that falls under DEI. What for you would be the big picture of non-DEI medical care? So I walk into a hospital and I am sitting beside a black female. We are the same age, same health problems. Lead me in that scenario from there to what you're advocating for.
Certainly. Well, in this case, what Cleveland Clinic would have done is it would have had a special program for the person sitting next to you that was a different race, and not based on higher risk factors for that person by their own admission, but by historical injustices that they claim they were trying to rectify. So that's the difference between saying that there's a higher risk factor for a certain race to have things like strokes and that kind of thing, versus saying that you're trying to engage in equity. And that's what Cleveland Clinic was doing, according to their own admission, for the program when they set it up.
So in the bigger picture of things, why is any governmental agency, be it the president sending down something, be it Congress passing laws, why are they doing so with healthcare? Should healthcare not truly be between that person and their doctor, unless there are some outlying reasons, as in, we have basic protections against them not treating someone of color, against them not being... Why is it that it's governmental involved, especially since the party that seems to be advocating so much for healthcare right now is a party who clearly says they wish to have government out of our lives as much as possible? I don't want the government in my healthcare, as I'm sure most people don't. So why then is this a huge governmental issue at this point?
Well, for a number of reasons. First, as you mentioned, those basic governmental protections are against discrimination based on race, which is exactly what Cleveland Clinic was doing. So even the things that you just mentioned, they are entailed here. Second of all, when it comes to Cleveland Clinic and a lot of these big healthcare systems, they receive hundreds of millions of dollars of federal subsidies, both through direct grants. They also receive favored tax status, and they are paid for with our Medicare and Medicaid dollars. So there's not really a question here of whether government's going to be involved. It's just a question of what policies it's going to be supporting. And in this case, the President of the United States has said that he doesn't want race and sex-based discrimination or discrimination of any kind through DEI engaged in our healthcare system. I don't think that's a question of whether the government's getting involved between you and your doctor. They're just making sure that when the government is providing these healthcare services through a number of different ways, that they're being done evenly across all populations.
Okay, and one last very quick question. You keep consistently bringing up the president. As far as I know, the president has no medical background whatsoever. I have not seen any proof that he has surrounded himself with medical experts in making this decision. So exactly why should we listen to the president's wants on DEI in our healthcare when he doesn't have the qualifications to make it? He is a politician, not a healthcare expert.
Well, that's generally true of all of our politicians. Most are not doctors, but they still set policy for how our healthcare dollars will be spent. And this administration has required that they not be spent in a way that triage people or create special programs for people based on race and sex. I don't think that's an outrageous thing. As you even note, that's in line with the basic protections that federal law is supposed to provide to all citizens of the United States.
Well, Hild, thank you so much for joining us today. We have learned quite a bit.
Thanks for having me.
I'm Crystal Carter. This has been A Closer Look.